Hi, I'm Dr. Derek Lee. It's my pleasure to introduce Dr. Michael Vitale, who's a professor of pediatric orthopedic surgery and neurosurgery, vice chair, quality and strategy orthopedic surgery at Columbia University Medical Center. He's also director, Division of Pediatric Orthopedics, chief, pediatric spine and scoliosis service at Morgan Stanley Children's Hospital of New York Presbyterian. Dr. Vitale, welcome.
Thanks, Derek. Pleasure to be here. Thanks for inviting me.
My pleasure as well. Now, April is Safety in Spine Surgery month. I want to get your opinion on it because it seems that you and your colleagues have started this particular program. This is the second year of the Safety in Spine Surgery month. Can you explain what that is exactly?
Yeah, thanks, Derek. The timing is great. We're a few days away from the beginning of Spine Surgery Safety Month. About 8 years ago, a number of us started an organization called the Project for Safety in Spine Surgery. You can see projectinspinesurgery.com. And there's lots of information and various collateral on there about how we can collectively make spine surgery safer together. For a number of years, we held the Spine Safety Summit here in New York, and this was a standing room only, sold out meeting 6 years in a row. In fact, we were the last couple of years simulcasting it because the demand was so high. And every year we had a theme, and every year we developed a best practice guideline ranging from how to avoid wrong site surgery, best responses after you have loss of intraoperative neuromonitoring signals in the operating room, best ways to implement halo gravity traction, on and on and on and on. 2 years ago, the pandemic got in the way of our live meeting, and the board of the Project for Safety in Spine Surgery pivoted and decided to have a virtual offering, which consisted of a couple webinars, but maybe more importantly, with regard to scale of messaging, a very large social media awareness effort. Last year, there were 225,000 engagements around this concept of safety in spine surgery, with all the major organizations, SRS, POSNA, study groups jumping on board and helping to boost that messaging. So I'm really excited about what's coming here in 2022, although I'm also equally excited about getting back to a live meeting for the Spine Safety Summit in the future.
Absolutely. What motivated you to put so much energy and commitment into this initiative initially?
Yeah, thanks. Well, I hate complications, and I know we all hate complications, but I particularly hate complications. And a number of years ago, I had a complication that made me think, how could we not be doing better about this stuff? I think, I've spoken quite a bit on the area of infection, for example. And in 2008, we had infection rates that were terrible, that were really unacceptable. And we did a whole bunch of things. That was really the first best practice guideline that this group put together, was best practices around how to avoid surgical site infection. In 2009, we had 0 infections. And since then have maintained a very, very, very low rate of infection. And if you think about that, you realize that what was happening prior to us really thinking collectively, working hard, paying attention to details, implementing best practices, was iatrogenic, was harm that didn't need to happen. Hopefully we're all on a journey where we're getting better. And I think work like this, leaders getting together, sharing stories, sharing best practices, allows us all to do better.
It sounds like it's gaining a ton of momentum. What has the feedback been from your peers? It seems to be quite enthusiastic already, and also from your patients.
It's a really fun meeting. People really want to come and get invited and speak at this meeting. It is thought leaders who are deeply committed and have really thought quite a bit about how to make spine surgery safer. It's a group of people in the spinal deformity space, but also cervical spine, also degenerative, also MIS, adult and pediatric. I think we have an opportunity to continue to broaden our audience around different areas in spine surgery, but it's been really fun. The other group of people that have really embraced it are the sort of spine surgery partners, hospitals, insurance organizations, and there's been quite a bit of involvement from those organizations over the years. because I think if we're really going to get better, we all need to work together from all the different perspectives that we have. Surgeons obviously can't do it alone. We need resources that are within the hospitals. We need help from larger organizations. A good example is a pay for performance initiative that we have with one of our local insurance carriers that incentivizes surgeons and the hospitals around our better outcomes. So it's a win-win, and I think we need to see more of this type of work together moving forward.
Just to touch on your own experience at your own facilities, how do you go about maintaining the highest safety standards?
I think we're really lucky because we are a very high volume facility. We do something like 350 or 400 pediatric spine surgeries a year, and that makes it easier, if we're honest, because we have dedicated spine teams, which I think is an important part of it. That means it's the same few pediatric anesthesiologists taking care of my patients, the same few nurses who are in the operating room with us, the same few people taking care of the patients on an outpatient. The second key is that everything is highly standardized. So I have a piece of tape in my operating room where the right upper wheel of the bed goes, and that allows me to have a standard setup for the lights, and that allows me to have standard draping and standard prepping. I think the more we standardize things, the better we get. We have, as you know, Dr. Lenke and Sardar and Lehman and Rue joined our practice some years ago. And when they joined, particularly with Dr. Lenke's very busy, complex pediatric deformity practice, we had to spend some time realigning our processes. But I think every minute that you spend doing that pays off with regard to better communication and better outcomes for patients. There's lots of structured communication. We have a multidisciplinary conference prior to the every single case where we discuss patients, share patients with everyone that will touch them. I'm really lucky that we have a fair amount of research and quality support. So we have a number of people that are just looking after processes. I'll give you a good example. If a kid ever has a pressure injury, like a rash or a blister because of pressure in positioning, that picture gets sent to everyone that touched the patient in the operating room that day. That simple process of operationalizing a near miss like that allows us all to be better. I think to get better, you need to make data visible and then work to improve outcomes. We have a structured approach about that, but again, it's a lot of this comes down to team and culture, and I feel really fortunate to be at this place. But these things that we're doing are things that are happening at different places very effectively as well. And that's the point of the Spine Safety Summit. When we get together, we share perhaps a couple things that I'm doing differently with a couple things that your group's doing differently, and come up with a product that's better than the sum of its parts.
Oh, terrific answer. From a parent's perspective, of course, safety is our number one priority. And it's great to see here that these initiatives are going on. Is there, just closing, would you like to address parents in terms of what your goals are ahead?
Yeah, I've been on both sides of the equation. It's no fun being a parent when your kid's having a medical issue or a surgical issue, and the responsibility that you feel is immense. And I think that all, as you say, that really matters is safety, 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 particularly in what we're doing. Stakes are potentially very high. We're operating on healthy kids, sometimes unhealthy kids' spines. And I think that just the simple focus on making safety a priority, by virtue of the so-called Hawthorne effect, meaning just the fact that you're paying so much attention to details around a process makes it better. What I would say to parents is that humans are fallible, but that's why you need a place that has processes and systems and checks and counter checks, because those things make it so much less likely that we have a surgical outcome, surgical complication. Our infection rate is still not zero. It's our infection rate for adolescent scoliosis now is hovering at about 1 in 500, but it's only gotten there because we've continually worked to drive it down because of learnings along the way. So I think this is a really important area, and I appreciate the opportunity to speak a little bit about it with you today, and the opportunity to share this message about the sacred obligation to do better around spine surgery safety.
Dr. Vitale, let's end it there. Thanks for taking the time to share that information, and looking forward to April, which is Safety in Spine Surgery Month. Thank you very much.
Appreciate it. Be well.